on This Morning.
Thanks,
wow,
guys.
what a prize. Now, also this morning, it's been referred to as yuppie flu, but the death last week of 31-year-old ME sufferer Lynn Gilderdale, following 14 years of near paralysis, highlighted the disease that affects 250,000 people in this country, often in the prime of their lives.
In a few moments' time, we'll speak to Vikki George, who was so ill with ME, she was bedridden, eating only baby food and unable to walk or talk. It was 5 years before she could even sit up. Thankfully, she is now gradually recovering. We'll hear her incredible story in just a moment.
So lots for you this morning. Here is your lineup. Now, yesterday, Kay Gilderdale was arrested in connection with the death of her daughter Lynn. 31-year-old Lynn had suffered from ME for 17 years. She was bedridden and virtually paralysed.
The case highlighted the disease once dubbed the yuppie flu, and joining us now is Vikki George, who we said fell ill with ME after a bout of glandular fever. By the age of 17, she couldn't talk, she could barely walk. And joining Vikki is Dr. Charles Shepherd, the medical advisor to the ME Association. And welcome both. Thank you very much for coming in today. I think, actually, can we start with you, Dr. Shepherd? I know that it annoys you enormously that it's still referred to occasionally as yuppie flu.
Yeah, could we get rid of this myth? This is a media myth. It was dreamt up by the papers in the 80s when there was quite a lot of publicity about this illness. It has nothing to do with yuppies. It affects all age groups, it affects all social classes, and it affects ethnic groups as well. So that is a total myth, like many other things surrounding this illness.
So I mean, you're here today to try and clear up some of those myths. Do we know what it is?
It's a complicated illness, but in trying to simplify it, it's an illness which often starts in previously fit young adults, often 20s, 30s, 40s. They get an infection. Sometimes, as in the case of Lynn that we've been talking about, it's a vaccination that triggers it off. And then something seems to go wrong with the body's control mechanisms. But what we know from the research at the moment, what keeps it going, are abnormalities in control mechanisms within the brain, the muscles, also the hormones in the body and the immune system, and all these seem to be interacting to keep it going. And another myth of this illness is that it's self-limiting. It all sort of goes away in 3 to 6 months. Now, that may be so for people who just have a post-viral fatigue syndrome, a simple fatigue illness that follows many infections. Many people are familiar with this post-flu flop. It's not that. It's an illness which goes on in many cases for many, many years, and sadly, as we've heard from Lynn, and Vikki's going to tell us as well, it's an illness which, for about 25% of people, is very severe. This is people who are bed-bound, wheelchair-bound, house-bound, and sadly, in some cases, very severely ill, like Lynn was, and steadily deteriorating over a course of time. Well,
that sounds like Charles is describing
Very
you
familiar,
there.
yes.
Yeah, bed-bound, in the wheelchair, and this all started when you were 11.
Yeah, when I was 11, I caught glandular fever, and it started with constant migraines and the general glandular fever symptoms. But whereas everyone else at my school who'd got it got better, I didn't. I did recover to a degree where I could go back to school, but I still had these constant migraines and stabbing pains in my head, which to this day I've still got.
So obviously your mum would have taken you to the doctor. So what did they tell you at the time?
First, they thought it could be glandular fever, and they put me on painkillers for the headaches, and then it was thought maybe my fatigue and everything was down to the painkillers, and maybe that was what was causing my headaches. And then it was a case of, we don't know for a while. Then they looked into the headaches, and it wasn't until 5 years later that I finally got diagnosed.
5 years?
By which time I was off school completely.
Yeah, that's a long time, 5 years. That must have been very hard, especially in your teenage years, when all your friends are out and about and getting boyfriends and doing things that teenage girls do. How was that affecting you emotionally then?
Well, you kind of get used to it, you know, you stop questioning it because it's part of your everyday life. And at that time I was able to go to school, although I missed chunks. I did still go out with friends and that, but everything came with a payback. They'd go home and be fine. I would end up feeling rough for a few days.
And at its worst, how bad was it?
At my worst, well, I didn't sit up or walk for 5 years at all. At my worst, I was completely bedbound in a blacked out room. I couldn't talk, I couldn't walk. I could barely swallow, I couldn't chew solid food, I had to suck ice cubes. My parents would spoon feed me a couple of teaspoons of baby food, then roll me over to vomit. And
there were also people who said to your parents, well, what you need to do is you need to show a bit of tough love.
Yeah,
you know, come on, get yourself sorted, get up. Yeah.
But Charles, this is what astounds me, when you've even said to yourself that at medical school they're often taught that this is a non-disease.
That's what I was taught at the Middlesex
Yes.
when I was qualifying. Yes.
How can anybody, when you're faced with Vikki, somebody like Vikki, with these dreadful symptoms, the girl can't get out of bed, how can anybody say, well, this is just in her head?
Well, you can't, but I mean, some of my colleagues, it is just so ingrained upon us that this was a non-disease. It was even mass hysteria, as described in the British Medical Journal at one point, have been left with this, and this is what is ingrained in their minds. And sadly, one result of this is that the patients at the very severe end of the spectrum, the people who are bedbound, housebound, are not getting access to hospital-based services, either for inpatient assessment and management or for domiciliary, home care. And in many cases, I'm not quite sure what happened with Vikki, they just lose contact with the medical profession completely altogether.
To see the doctors, which was with great irony. I was seen regularly at the hospital until I became too ill to see doctors regularly.
Well, at that point, it goes. The link with the medical profession goes, and it's almost do-it-yourself chronic neurological illness management. But apparently still between
10% and 20% of doctors are still sceptics.
Well, that was a guess I put in the Times. I mean, we've no accurate figures. This is just my view from talking to my colleagues. We still have a significant number of doctors who remain, sadly, some of them are just totally hostile to it and won't even diagnose it. But a significant number are still very sceptical about it.
One doctor came and after he'd seen me, and when I was really quite bad at the time, he said to my parents, oh, Emmy's people just don't want to grow up and face reality, as if this was what I wanted kind of thing, and you just don't stand a chance with people like that.
Well, how have you got then from your darkened room and being sick and being fed baby food and not being able to talk and not be able to walk, how have you got from that to this? What's been your road to recovery?
Really,
Is it?
Because I'm still in bed nearly all the time in my blacked out room, but I can now go out in my wheelchair and that. But I think mostly it was just time, and then after 5 years I improved, and by chance we found a local ME service which had been on my doorstep all this time, but we never knew about it. And I've been seeing the physio and been building up exercises. But by exercises, my first one was sitting on the edge of the bed for 10 seconds. My vision would go, my head would swim, I'd feel nauseous, my body would shake. I had to look in a mirror because I couldn't even work out if my body was straight or not. So it's not most people's idea of exercise.
Are you on any medication?
I am. I take about 8 or 9 different medications to try and control the symptoms, but they do help a bit. And
what are the chances of recovery?
Well, we seem to have 3 or 4 groups of people. We have, unfortunately, this group who are severely affected, some of whom remain severely affected. But as Vikki said, there is, positive hope for people in this group even, and Vikki has made slow but steady progress, and some people in that group do. We have a sort of middle group whom I think most people fall into. They make some degree of recovery, it may be quite a significant degree of recovery after being, totally knackered after their initial infection. But then they sort of reach a plateau, and then they have ups and downs. And then we have another group at the other fortunate positive end of the spectrum who progressively get better and get back to full normal health. But they are actually in a minority.
Well, what we'll do is we'll put links to your site on our website, and any help that we can possibly give if there's anything that's struck a chord with you today. Best of luck for your continued recovery.
I took my first unaided steps last week for 7 years, so I'm onwards and upwards.
Well done.
Well done, you.
Thank you.
We wish you well. Thank you.
Thank you very much,
Sure.
both of you, for coming in.
Charles.
It's itv.com/thismorning is our website.